There's a popular African proverb that says, if you want to go fast, go alone. If you want to go far, go together.
The Healthcare Working Group is actually BSR's longest standing collaboration. It's been going on for 20 years. We started in 1999. We're a group of basically big pharmas and biotech companies and rare disease companies working together on different kinds of issues, all advancing global health.
I think there are a lot of societal issues that we together as an industry can work together on, and the first one that obviously comes to people's minds are around patient access. How do we ensure patients have access to the innovative medicines that are out there?
The biggest thing that probably the Healthcare Working Group achieved, which was pretty amazing, was to develop the guiding principles on access to healthcare. So it was a recognition a few years back that there was no common definition among the Healthcare Working Group members, but also among stakeholders on what was meant by access to healthcare. So we sat down with stakeholders, with the Healthcare Working Group member for months to develop what became the guiding principles on access to healthcare, which were then endorsed by 13 CEOs of big pharma companies, so quite a big achievement.
But of course, access to healthcare is one part of sustainability for healthcare companies. In addition, we actually work together on a wider range of topics that include the nexus of climate and health, antimicrobial resistance, or for instance the ethics of technology and what that actually means to healthcare companies.
Individual companies are great at focusing on where their R&D is making a difference, where their pricing and access models are making a difference. But the industry contribution only goes so far, so collaborating with the other players in the healthcare system to really reach that last mile of patient access, I think is an area where we can do more to collaborate.
Well, I certainly think there is a need for collaboration in our industry because we all get so involved in our day jobs, and we also tend to think sometimes it's just us with this problem, and then we realize we pick our heads up and we go, oh wow, there's so many other companies that are struggling with exactly the same things.
I think the Healthcare Working Group provides an excellent forum for multiple companies to come together to share best practices, to understand what are the key trends that are ongoing now and what are the emerging trends that are coming.
I'll never forget the first BSR meeting I went to. It was in London, and I walked in and to see so many people from across so many different parts of the industry, all working together, all sharing their thoughts, best practices, answering questions for each other. The camaraderie and the expertise in that room was just unbelievable.
20 years later, we're still doing the same thing. We're looking at what's on the table, what's keeping us awake at night, and trying to find solutions collectively.